Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Today we are going to cover chapter 2, types of injuries, sprain and strain. For the outline, at the end of the chapter, students should be able to identify and recognize strain and sprain. As an introduction, there are three musculoskeletal systems that related to strain and sprain. They are muscle, tendon, and ligament. Okay, now we are going to proceed with muscle. Okay, for muscle, example, biceps and quadriceps. So as the explanation, band or bundle of fibrous tissue that has ability to contract, producing movement. Okay, so kind of injury is strain. For tendon, as an example, Achilles tendon, a strong fibrous collagen tissue attaching a muscle to a bone. So this can lead to strain injury. And for ligament, medial collateral ligament, or we call that MCL, a short band of tough, flexible fibrous connective tissue which connects two bones or cartilages or holds together a joint. This kind of explanation for ligament can lead to injury sprain. Chapter 2.3, strain and sprain. Now we are going to discover strain. What is strain? An injury to a muscle or tendon that occurs when the muscle is stretched beyond its normal range of motion, causing the muscle to tear. For example, hamstring strains or pull. Results of overexertion lead to tear of muscle fibers, and then strain occurs when muscles are stretched beyond their normal range or when cold or tight muscles are suddenly exerted or happen. Common area for strains, lower back and hamstring. This is the common sign and symptoms for strains, and they are extreme pain, severe tenderness, pain or stiffness in the muscle is moved, a bump or indentation that can be seen or felt, loss of function of the injured muscle. Normally, we can't move when we experience strain. Okay, this is also the common symptoms of a strain. Number one is pain. So I would like to elaborate all the points given for common symptoms of a strain. Okay, for pain, this is a primary symptom which may be immediated or develop gradually and typically worsens with muscle contraction or movement. Swelling and bruising. Inflammation and bleeding in the injured muscle can cause swelling and discoloration. Limited motion. You may find it difficult to move the affected body part or have a reduced range of motion. Muscle spasms. The muscle may experience sudden or uncontrollable contraction. Then we proceed. Muscle weakness. The injured muscle may feel weak or unable to function properly. Pop sensation. Some people may feel or even hear a pop at the moment the muscle is injured. Visible gap or dent. In more severe strains, a gap or dent may be visible in the shape of the muscle. Last symptom is redness. The skin over the injured area may appear red. Next, we are going to discover sprain. What is sprain? An injury in which ligaments are stretched and partially or completely torn. For example, ankle sprains. The signs of a severe sprain are similar to those of a fracture. Most common signs and symptoms: pain, swelling, deformity, discoloration, and inability to use injury part. Later on, I will cover completely about common signs and symptoms. Joint area must often sprain is Joint area must often sprain are thumb, knees, and ankle. Severe sprains may rupture ligaments or dislocate or fracture the bones that form the joint. Okay, now this is the key signs and symptoms for sprain. Number one is pain, discomfort in the injured joint area. Number two, swelling. The injured area may swell up quickly. Number three, bruising, discoloration or bruising of the skin around the joint. Number four, reduced range of motion or ROM, difficulty moving the joint through its full range of motion. Next is instability, a feeling of looseness or inability to put weight on the joint comfortably. Popping sound and sensation, you might hear or feel a pop at the moment the sprain occurs. Stiffness, the affected joint may feel stiff. And lastly is warm, the injured area may feel warm to the touch. Grade of injury for sprain and strain. So there are four grades which are normal, grade 1, grade 2, and grade 3. For grade 1, stretch and small tears. For grade 2, larger tear or partial tear. And for grade 3, complete rupture. Okay, now we are going to explain in details regarding the grade of injury for sprain and strain. Okay, severity and diagnosis for sprain. Grade 1 sprain, we consider as mild. Ligament damage, microscopic damage with slight stretching of ligament fibers but no tear. Symptoms, mild tenderness and swelling around the joint. Function, minimal pain, and the patient can usually walk with little difficulty. Instability, no joint instability. For grade 2 sprain or moderate, ligament damage or partial tear of the ligament. Symptoms, moderate pain and swelling along with tenderness around the joint. Function, restricted range of motion and difficulty bearing weight or walking. Instability, mild to moderate joint instability. Lastly, grade 3 sprain, considered as severe. Ligament damage, complete tear of the ligament. Symptoms, severe pain, significant swelling and bruising. Function, significant loss of function and inability to walk or bear weight on the injured limb. On the injured part. Instability, significant joint instability.